This patient has an EGFR mutation, so it's not at all unexpected that she's wild type for KRAS and ALK. In general, we do test for many mutations at a diagnosis of advanced or stage 4 non-small cell lung cancer, specifically lung adenocarcinoma, and looking for EGFR and ALK are two of the most important genes to look at because we have targeted therapies that can work very well for those. There are other mutations or genes that are very important to look for mutations in, including ROS1, BRAF, there's many others. MET is actually also an important one. KRAS is an interesting one to talk about because we don't have targeted therapies for KRAS. One important reason to check it might be that typically if there's a mutation in KRAS, the other ones are usually negative, although sometimes you can see multiple alterations in genes. But typically if one is positive, the others are negative, that they're mutually exclusive. So again, in this patient, it's not surprising that since she does have an EGFR mutation, that the ALK and KRAS are negative. There are two types of EGFR mutations that are by far the most common in non-small cell lung cancer, specifically lung adenocarcinoma, and that's the exon 19 deletions and the L858R point mutation in exon 21. So those two types of mutations make up, again, the vast majority of EGFR mutations, probably around 90% of the mutations. So when we see a patient with an EGFR mutation, that's typically what we see. And those two types of mutations typically make the cancer very sensitive to EGFR inhibitors. And so when we find that, it's usually a very good thing for the patient because we have drugs that can work very, very well for their treatment. There are several drugs that we have now that are EGFR inhibitors that are options for patients. But those are the common mutations. That's what they're typically called, the common EGFR mutations, and they are sensitizing as well, meaning they sensitize the cancer to the EGFR inhibitors. EGFR mutations can be in this rare category or uncommon category. About 10% of them fall into that category, and this patient has one of them, the G719 mutation. There are about 10% of EGFR mutations fall into that uncommon category. And what's important to note about the uncommon EGFR mutations is that some of them still are sensitizing. So uncommon doesn't necessarily mean that the drugs won't work, the EGFR inhibitors won't work. So uncommon can be sensitizing to the drugs, and that's the case with this patient's mutation. This is a type of mutation that is uncommon, is rare in EGFR, but still can make the cancer sensitive to the EGFR inhibitors.